here to talk to you about the Teachback method as part of my thesis project. Thank you all for participating. It is definitely not the original plan of how I would teach these concepts, but thanks to COVID, I am learning a new technology and I don't have to wear a mask, so can't complain about that. Anyways, I'm going to review the definition and purpose as well as some key elements of Teachback, and then give you some examples of good questions you can use with your patients, and then some documentation specifically in EPIC on Teachback. And I'll wrap it up with a demonstration video to tie everything together. So the definition, there's two types: verbal, where you ask the learner, in our case the patient, and sometimes a family member, to repeat what has been explained to them in their own words. And then demonstration, you show them a skill and they demonstrate this skill back to you. This particularly happens especially at discharge. Some examples might include if they're going home with the Foley, that they know how to empty the bag or the JP drain, or a Lovenox injection, that they can do the subcutaneous injection before they're home and on their own with no help. So the purpose of Teachback is mainly to evaluate the effectiveness of your teaching, but also the learning and understanding of your patient. And if the patient does not demonstrate understanding and learning, then it gives you an opportunity to correct and re-educate or try a different way of teaching them before they go home. So now let's talk about the key elements for Teachback. They really emphasize that they want you to create a good learning environment where you sit down, are on the same level as the patient, make eye contact, and use plain language, avoid yes and no questions, because they really want you to engage the patient in learning. And then make sure to have printed materials to support learning. We have a lot of resources as far as the discharge instructions, and then education, printed materials, and make sure you document. So now let's look at some examples. I want to be sure that I explained everything clearly. Can you explain it back to me so I can be sure that I did? What will you tell your husband about the changes we made to your medications today? We've gone over a lot of information. In your own words, please review with me what we talked about. So these are some ideas. You can make it your own. But as you can see, it's pretty simple and conversational, but it definitely is an effective way to measure the level of understanding of your patients. So for EPIC documentation, this should look familiar. It's under the Education tab, specifically the discharge teaching points. And there's two different boxes you can check for Teachback if you used the demonstration or the verbal, or you can select both. Part of my project, I will be auditing these charts after everyone watches this video. So be sure that you document and give yourself credit for doing Teachback. And thank you in advance. Okay, so now that we've gone over everything, I want you to watch this video. It's animated, just to reinforce all the concepts of Teachback in an actual clinical setting.
What in the world is Teachback?
Teachback is a way to confirm what your patient understands of what you've explained. It's a great tool that will not only help reduce our readmissions and improve our patient's experience, it improves our patient's comprehension.
I just don't understand. I don't have time to do Teachback, and furthermore, what would I get out of it? Plus, I feel like I would be quizzing my patients and putting them on the spot.
I know. I felt that way too when I first started hearing about TeachBack, but I started to find phrases that worked for me, and now it feels authentic. I could actually see it help my patients and found that it helps to reduce the calls I receive after I've left the room.
Hey, you two, what are you talking about?
We just had this meeting about TeachBack.
TeachBack? What's that?
TeachBack is really a best practice that enables us as providers to learn from the patient what they understood by asking them to repeat back what they heard us say.
Oh, sure. I do that with my patients. As a nurse, I think it's my job to make sure I explain things well, so I'll say, I know we covered a lot of information. Can you tell me what you heard? Or I'll ask them a question like, when you get home, how many times a day are you going to take your medication? And just make up questions to be sure they understand. If they go home and don't understand how or when to take their medications, they could end up back in the hospital, and who wants that?
So do you just use TeachBack at discharge?
It's very useful during discharge, but I also use TeachBack when I'm doing any kind of education, or for sure when I'm sharing a new diagnosis. I've also used it when I see patients in the clinic too. It helps to make sure they know what the plan and the next steps are from the visit.
Yeah, I use it during their visit after I have reviewed the plan of care and what's coming next.
That's interesting.
Morning, Kevin. Have you thought any more about that TeachBack we were talking about?
No, but even if I wanted to incorporate this, I feel funny. It feels forced.
Let's try. Come with me to Mrs. Smith's room. I'm going in to discuss her discharge instructions, and you can see how I try to incorporate TeachBack. Knock, knock. Hi, Mrs. Smith. It's Dr. Gray again. I have Dr. Campbell with me as well. Would it be okay if he joined us today?
Yes, that would be all right with me.
Great, thank you. Well, Mrs. Smith, you're doing much better now, so we're ready to send you home. But it's really important that you make an appointment to see your primary care doctor, Dr. Johnson, within the next 5 days. If your symptoms get worse between now and then, we want you to come back in right away so we can check you out. It's also really important that you take your medication as prescribed, 2 pills 3 times a day with food. Mrs. Smith, I know we've covered a lot, and I want to be sure I explained everything to you clearly. Can you tell me what you're going to do when you get home? When will you go to see Dr. Johnson?
I'm going to contact my doctor if I'm not feeling better in the next 5 days.
I'm sorry, I must not have explained it all very clearly. What I actually want you to do is to call Dr. Johnson, your primary doctor, and make an appointment to see him, regardless of how you're feeling, within the next 5 days.
Oh, I see. You want me to call my doctor even if I'm not feeling bad. I should still plan to follow up with Dr. Johnson in the next 5 days.
Yeah, that's right, you've got it. Now let's see, what questions do you have for me?
I guess that made a difference. She actually didn't understand.
Yeah, sometimes it's the small details that can make a big difference in how the patient does after they've left the hospital. It's always best when we can clarify those details in person before they go home. A few moments of TeachBack in the moment can help ensure patients receive the right follow-up and can save time in the long run. What do you think about TeachBack now?
I think I want to give it a try. I'd hate for my patients to be missing key details in their care. I guess I don't really know what my patients are taking away from my explanations and instructions, and I won't find out unless I ask them.
All right, that just about concludes my presentation. Thanks again for watching. Before I leave you, I wanted to make sure and mention my references listed here, and then invite you to take the next step now that you have learned about TeachBack. Get out there and use it with your patients.